All right, welcome back, everybody. We will get started with the afternoon talks. Hopefully, everybody got up, moved around, and is wide awake and ready to go after lunch. We're going to start with Dr. Nicolas Hatamiya. He is a specialist in primary care sports medicine and enjoys caring for patients of all ages and strives to provide comprehensive care. He has particular interests in diagnostic and interventional ultrasound, preventive medicine, and exercises medicine. He earned his medical degree from Western University Health Sciences. At Stanford Healthcare, he completed residency in family medicine, serving as chief resident and completing the faculty development track. At the University of California, Los Angeles, he completed a fellowship in primary care sports medicine. He's a team physician for the Academy of Art University and the Oakland Roots soccer team, and previously served as a team physician for the UCLA Bruins, the El Segundo High School, and assistant team physician for the Los Angeles Lakers and Los Angeles Dodgers. We don't talk about them here. And is also a member of the American Medical Society for Sports Medicine. So welcome, Dr. Nick.
Thanks so much for the introduction, Tom. Great to see everyone. And I will say that I'm a Northern California kid at heart. I'm also a Cal Bears, even though I did my residency at the other rival school. I always say go Bears. Well, I hope you all enjoyed the workshops, and I'm really happy to talk about a topic that's perhaps a little bit different than the ones you've heard about today, but something that I'm very passionate about, which is wearable devices in sports medicine. I myself am a self-proclaimed wearable junkie. I have two on my wrist right now. I have a Whoop and my Garmin. And just out of curiosity, how many of you out there have some sort of wearable device that you're wearing, whether that's an Apple Watch, a Garmin? Yeah, wow, quite a few of you. Great. So, I think that this is a broad topic, but I really want to highlight some things that our athletes are using that are more novel. Talk about some stuff that your patients may be talking about, or might even be a personal interest for a lot of you who are wearing wearables in the audience. I have no relevant disclosures, and the slides will be a little bit different than the ones you have in your syllabus. The syllabus ones are more comprehensive. I thought I had more than 30 minutes to talk, so I last night went through my talk and tried to delete a whole bunch of slides, but you have the more comprehensive set. I want to start by talking about just some background and history about wearable devices, and then talk about different wearable applications, which you can see there. Obviously, I think wearables are used for a lot of different things, but I think that these are some of the most common things that are being used, wearables are being used for, and then some of the more novel things as well. And then if there's time, I'd like to just have a food for thought discussion about some potential consequences or challenges surrounding the use of wearable devices. All right, so let's start with some background and history. And I think before we dive into it, it's good to define what wearable tech is. And this is related to ubiquitous computing and makes technology pervasive by incorporating it into our everyday lives. And they're devices that can be worn as accessories, and they're hands-free gadgets that have microprocessors that can both send and receive data. And they're embedded into our clothing. They can be implanted into bodies, and then also can be tattooed onto the skin. And I like to geek out about things when I present about it, so we're going to really dive into some of the history to really understand where wearables started. So in the early 15th century, Leonardo da Vinci wanted to track the distance that a Roman soldier walked and created this little instrument here to look at the amount of distance that they traveled. If we fast forward to the 1500s, there was a German clocksmith who created a clock and then affixed it to clothing. And that was really the first time that some sort of device was worn as like a fashionable thing or onto clothing. So the first wearable, so to speak. And then in the 1700s, there was a Swiss clockmaker who made the first pedometer, which you can see there. If we fast forward to the 1920s, this is when the polygraph machine was started. So the lie detector test, right? And that used different sensors to measure skin temperature, galvanic skin temperature. And then in the 1960s in Japan, the pedometer really gained a lot of traction, and they called it manpoke, which really just means 10,000 steps. And we'll talk a little bit more about steps, but this gained mainstream media attention. And then in the 1970s, accelerometers, which were previously used by the military and space industry, became available for commercial use as well. And this is where automakers such as Ford started incorporating them into our vehicles for airbag deployment. Around that same time, I think wearables became more mainstream in the media. So many of you may recognize or perhaps own this. This is the Casio Data Bank calculator watch. And you can see that Sting on the album of the Police here wears his, Casio Databank watch. And then Marty McFly from Back to the Future also sported that as well. And if we look at wearable technology in relation to athletics, it was around that same time with that Databank watch that there was this Finnish professor named Seppo, who's pictured here, that wanted to find a better way to track heart rate as a training tool for the cross-country team. And he created a small company called Polar that created the first heart rate monitor that was used in athletes. And he called it the Sport Tester PE 2000, which is a very futuristic name back in the 70s. But you can see what that first heart rate monitor looked like on the right there. And then over the next several decades, we saw continued advancements in heart rate monitoring. They became smaller and more accurate. And then in 1966, GPS data became available for all of us to use. And this was a huge advancement. And this is also when we got GPS devices to use in our cars, right? So those big Garmin's or TomToms that you would plug in and now we just use our phones. But that really led to advancement in some of the wearable technology space. And in 2002, that's where we saw the rise of Bluetooth technology. And around that same time, that Bluetooth technology really led to more advancements. So you may remember that Nike partnered with Apple to create this little pod that you can put into your shoe, and then it would send data to your iPhone or your iPod Nano back then to let you know how many steps that you were taking. Nike also came out with this Fuel Band, which doesn't exist anymore, but that was an activity tracker that you could wear. The first Fitbit came out, and then the Jawbone Up, which doesn't exist anymore, also came into existence. And all of this led to this quantified self movement, which was a cultural phenomenon about self-tracking through technology and understanding yourself through the numbers that you would provide. And there's lots of media attention kind of surrounding this as well. And in the 2010s, we saw in 2013, Google Glass was created. In 2015 is when the first Apple Watch came out. And then in 2016, the Oculus Rift came out. So that was the VR headset. And nowadays, you may recently have heard about the Apple Vision Pro that came out, and you might see some of our athletes like JaVale McGee here showing up for an NBA game and wearing his Apple Vision Pro when it looks like he's about to hit the slopes instead of playing in a basketball game. If you look at the wearable industry globally, it's one of the fastest advancing sectors and now outpaces the development of smartphones. And in 2019, this market size was estimated to be around $32.5 billion. And the report that I read is that there's projected to be compound annual growth of around 15% each year, which is quite astonishing if you really think about it. Here in North America, we're the largest contributor to the global wearable industry. And this just is here to kind of depict that exponential growth here that we expect in the United States. And then it also divides it, based off of the wearable type, but we'll talk a little bit more about that in my future slides. Another way that's, I think, important to understand wearable tech is kind of how we classify it. And really, there's two different ways. So you can think about it in terms of its form as well as its function. And if we talk about the different forms, there's a lot of different forms. So, I have two wrist wearable devices. Some of you may have rings that you use to monitor certain things. There's headwear. As I mentioned, it can be embedded into your clothing, footwear, and then even embedded into the skin as like little tattoos that you can wear. If we look at the market share, this is from 2019, you can see that wristwear comprises almost of half of the total wearable market, followed by the eyewear and headwear. And I'm sure this has changed over the past several years, but I think wristwear is still the most predominant form. When we talk about function, I like to think about it in two different buckets. So there's the movement type, which are like accelerometers or those GPS devices. And then ones that collect more physiologic data. So those things are like heart rate, your skin temperature, your sleep, etc. And the goal of all of this is to really create a feedback loop, right? So we have the user who's using some sort of sensor or device that processes the information and then presents it back, whether that's through an app or through the device itself, back to the user. So you create that feedback loop. And then with all of these, you can create this broader ecosystem where the user is tracking a bunch of things through maybe various different devices that gets analyzed by some cloud or some data thing. And I think you can add a layer here now of like AI looking at all of this data, right? And then presenting it back to the user in some sort of meaningful way. And the American College of Sports Medicine, which is one of our bigger organizations in the sports medicine realm, looks at fitness trends each year. And over the last 8 years, 6 out of the last 8 wearable devices has been the #1 fitness trend. And in the 2 years it wasn't, it was second and third. So definitely really popular in the fitness space as well. Now that we have an understanding of what wearable devices are and kind of the history of it, we'll talk about some of the applications. And the first one is step counting, which I think is one of the most common things we tend to think about. So just out of curiosity, how many steps per day do you think we all need to take or is recommended? And you can just raise your hand. So how many of you think A, at least 5,000 steps per day? Anyone? Nope. What about B, somewhere between 5 and 74? Yep, okay, so a few people. What about C? All right. And then D? Okay. And then what about E? Or maybe D and E? Yeah, okay, great. So we'll talk about that a little more. We know that wearable devices can increase activity as well as our health. So this was a systematic review that looked at individuals that use pedometers and found that those that use some sort of device to track their steps tended to increase the number of steps by around 2,500 steps per day, but also just increase their physical activity by around 25%. This also led to decreased body mass index as well as improvements in their blood pressure. And all of these were actually associated with having a particular step count goal, right? So if you use the device and you had a step count goal, that was strongly correlated with having these improvements. We also know that steps can help decrease all-cause mortality. And this was a study that looked at women demographics specifically, and it was a prospective longitudinal cohort study. And they had women wear a wearable device and looked at how many steps that they took, and then prospectively followed up with them longitudinally on an annual basis, and then looked at all-cause mortality and correlated that back to the number of steps they did. It might look really small on your screen there, but this graph looks at the relationship between the hazard ratios of all-cause mortality as well as step count. So down here on the x-axis is step count, and this is all-cause mortality. And what you'll notice is that the ones that took less steps tended to have a higher hazard ratio, right? And then as you took more and more steps, that hazard ratio decreased, but there was a plateauing effect. And if you look, it's really small. Around 7,500 is where it tended to plateau off. And so what they found was that as few as 4,000 steps per day could significantly lead to lower mortality rates compared to 2,700. And then with more steps per day, it tended to decrease that risk, but had a plateauing effect at around 7,500, right? So maybe 10,000 is not what you need, but who knows? We'll look at a little bit more data. These are a couple of other studies. So the first one looked at all demographics, so both men and women, and found that less than 4,000 steps per day had the highest mortality, and that each additional 1,000 steps tended to lower that mortality risk until you hit about 12,000 steps. So again, another threshold there, but I think the gist is lower steps can lead to higher mortality. And then the last one looked at arterial stiffness in relation to steps and found an inverse relationship. So the more you walked, the lower stiffness you had. And they found that specifically those that did less than 5,000 steps compared to 7,500 was significant, and then less than 5,000 compared to 10,000 was significant, but not as significant between the 7,500 and the 10,000. We also know that it can be helpful for mental health, and I think that that's really important for all of our athletes and patients. This looked at the impact of a 100-day, 10,000 step program on different aspects of mental health, depression, anxiety, and a well-being score. And I know this probably looks really, really small as well there too, but they basically looked at less than 10,000 and over 10,000. And they did pre and post tests for anxiety, depression, stress, and wellness. And what you'll notice is that no matter what category they looked at, whether it was less than 10,000 or more than 10,000, pre and post, those that participated in the program tended to have improved scores. And so what they found was that a step counting program can improve mental health and well-being, and that the target that you reach is less important than participation itself. And so what my general takeaways are from all of this, and certainly there's more, but I think that using a wearable device to track and monitor your steps can promote physical activity, which in turn, as we know, physical activity can improve your health metrics. Step counting can be helpful for your physical health, but also your mental health. And I think that around at least 7,500 steps from the literature out there seems to be an effective target. I think certainly more can be better, but that 10,000 step that we always tend to think about, I think really goes back to that Japanese pedometer that was made, right, Monpoke, and perhaps the data doesn't exactly support the need for 10,000 steps. I'd like to now shift to another topic about training load. And this is a way that our athletes are using wearable devices. And I think it's first important to understand what training load is. So it's the cumulative amount of stress that's placed on an individual from either a single training session or multiple training sessions over a period of time. And this includes both internal and external load. So internal load is like your stress, your mental health, and your well-being. External load is more of those physical aspects of load that get applied to there. The International Olympic Committee came out with a consensus statement back in 2016 where they recognized that poor load management can lead to injury risk factors, or is a risk factor for major injury in sports, and that regular athlete monitoring is fundamental, but we need to validate the efficacy and sensitivity of those technologies that monitor training load. There have been some studies that look at what sort of technology we use, but this study actually highlighted a bunch of other studies. It was a review article. And what you'll find is that the sports that tended to use it were mostly soccer, rugby, or Australian football. Large proportion were males, and then most of those were at that elite or professional level. But the most commonly used device was these GPS sensors, and we'll talk a little bit more about what those look like. And then they did find that 36 of the studies looked at the relationship between workload and injury risk and thought that there was some utility in using this. I think it was mentioned that I'm one of the team physicians for the Oakland Roots, so our athletes actually use a wearable device here called a Catapult to monitor their training load, and they use it for all their practices and their games. And what that provides is really cool but granular data. So the athlete that's wearing it, you can create heat maps about where they were on the pitch, how much time they spent in a certain area, what their max speed was, the total distance that they traveled. And with other wearable devices, you can actually get very granular to how many ball touches they had and where they were on the field. It's also used in the college athletics setting, and Cal was one of the early adopters of using such technology. They also use the Catapult, which you can see here with our football team. And I always think it's really funny seeing like a big lineman wearing the Catapult that looks like a sports bra out there. But it just goes to show that if they're invested and think the data is worth it, they're willing to really do anything. But the goal of all of these devices is to find what's called the sweet spot. And this was published a while ago by Tim Gabbett and is a little controversial now, but I think it provides a nice framework to kind of think about load. And this is specifically looking at what's called the acute to chronic workload ratio. So that's basically the amount of load you put on in a 7-day period and comparing that to the 28-day period load. And if that ratio exceeds 1.5, then you're in the danger zone. And then there's a sweet spot that you should aim for. So it's really looking at that ratio of how hard you're working in the acute setting versus the chronic setting, and taking that into account when thinking about injury risk. Is there any data to really support this? And I think that this is something that we're still collecting. The NBA notoriously talks about load management all the time, right? And they came out with this headline in the past several months, so it was in the fall, that talks about load management may not be supported. We have a big meeting for all of our primary care sports medicine physicians coming up actually next month, where some of this data is going to be presented. So I think more to come in this realm. The other area I wanted to highlight that wearables are used for is for infection, identification, and prevention. You all may remember we had that small pandemic that happened a few years ago, but I think during that time, we were really looking at ways to help monitor and surveil it, right? And this was a review that was published that looked at using technology for sports in relation to COVID. And one of the big pillars that they included there was using wearable devices. And just as a refresher, you might remember that we were looking at who was a high-risk contact based off of how much time you spent in proximity to another person. And then if you were a high-risk contact, you had to quarantine for a while, right? And then test yourself if you had symptoms. And so when our sports teams returned, they were using these proximity devices to help define, who was a high-risk contact. And the NBA used it as well as the NFL, and then a lot of the collegiate conferences. What that device was this little block that you could embed into clothing. So a lot of our athletes would put it into like their short bands or onto the back of their jerseys. And then all staff had to wear it as well. And this is a screenshot from a football game where you can see one of the coaches trying to get stylish and using it on the wrist. But really you wanted to track how close people were together and for what period of time. The CDC had a morbidity mortality weekly report that looked at some of the measures that the NFL was using back in 2020. And there were about 21 NFL cases where contact tracing indicated that there was within club transmission, but 7 of those persons didn't really have interactions that met the criteria of being a high risk exposure. And so what they concluded was that although these proximity devices could provide us with really detailed information, you basically needed additional info on top of that to really identify who was at risk or not. And so from that, they really redefined what the high contact risk definition was to include other things. That makes sense, right? But you don't think about, so were they using a mask at that time, yes or no? And then what setting were they in? Were they outside on the playing field and they were in close contact? Or were they like in the locker room right next to each other? Because we thought that that might make a difference. And then obviously adherence is really important as well too. So there were some athletes that would refuse to use these and would just leave the monitor in their locker, right? Which really defeats the purpose. We also use wearables for infection prevention, looking more at physiologic data. So you might remember the NBA went into a bubble and they gave all of the staff and athletes the Aura ring to wear there. And the goal was to really monitor some of their physiologic parameters to see if that could predict who would get COVID, right? And this was also done for frontline healthcare workers during the COVID pandemic, and UCSF was one of the partner sites for this. And what they basically found was that those that wore the ring, they thought that they could predict who would get COVID around 2.5 days on average before the person themselves got symptomatic, and had a pretty good sensitivity and specificity. Similar studies have been done in our athletic population. So this was in D1 athletes. And what they found was that 3 days before the person tested positive for COVID, they tended to have increases in their respiratory rate. And then the day before, their resting heart rate increased, the respiratory rate increased, and then their heart rate variability, which we'll talk about in a little bit, decreased. And so wearable technology can be used as part of a multifaceted approach to really detect COVID. The Department of Defense has also recognized this as well and has invested money for our military personnel too. All right, the next area is performance enhancement, and I alluded to heart rate variability. How many of you are familiar with what heart rate variability is? You have to raise your hand. Yeah, okay, a couple. So, I think historically we've used heart rate like that Finnish national team when they were doing the cross-country skiing as a training marker. And you'd use the formula like 220 minus your age to find your heart rate zone. We later started using it to correlate with something that's called the lactate threshold. So if you're into performance, you may be familiar with this. But now athletes are using it to look at heart rate variability. And what this is it's a qualitative marker that looks at your cardiac regulation by the autonomic nervous system and looks at the differences in R to R intervals. So if you count the number of beats, it looks at the variation in those beats. And it's not a new principle. It's been around since the 90s, and athletes are using it now to monitor the recovery as well as the readiness to perform. Cardiologists are also using it to look at whether it might be a marker for your overall health. And so how it's being used is really for a couple ways. So you're monitoring your resting heart rate as well as your heart rate variability. And the goal is if you have a higher heart rate variability, it's thought to be better. And if you have a lower heart rate variability, it's thought to be worse. And what they found was that those that are training that had a higher post-exercise heart rate variability tended to have improvements in their athletic performance. But if you were overtraining, your heart rate variability tended to decrease. This study looked at a group of athletes that used their heart rate variability to train. And so they had one group monitor it and another group not. And if they found their heart rate variability decreased, then they would do a lower intensity training or actually rested. And then they looked at their performance metrics at the end. And what they found was that the group that monitored their heart rate variability had higher performance metrics compared to those that didn't. So heart rate variability could perhaps be a tool for athletes to use. And there's a lot of ways that are proposed to improve this. So, hydrating, sleeping well, eating good nutrition, stress management. But I think still a lot is unknown with regard to this because there's lots of variables that play into it. But I think that there's a lot of research being done. So I think more to come. But I wouldn't be surprised if a lot of your athletes or even patients are going to start coming to you talking about their heart rate variability. So hopefully you have kind of a general sense of what that might be. The last thing I wanted to talk about was sleep. And I think we all know sleep is really important, but these wearable devices have been validated against polysomnography, which is kind of the gold standard for monitoring sleep. How many of you think that sleep, you should get at least 5 hours per day or around that time? I think you should get at least 5, but probably more, right? What about more than 5, but less than 7? No? Anywhere around 7 to 9 hours? Okay, most of you. What about 9 to 10? Couple. And then the more the better. Yeah, nice. I might be in the more the better group. So the American Academy of Sleep suggests around 7 to 9 hours for the average adult, but we think for athletic populations that more might be a little bit better, so 9 to 10. There's been this concept of sleep extension, which is basically spending a minimum of 10 hours in bed each night to try to extend your sleep duration. And several studies have shown that this is beneficial in athletic populations. So in Sherry Ma looked at Stanford basketball players and found that those that had extended their sleep tended to have improved free throw 3-point percentages, as well as improved sprinting times. Tennis players have improved serving accuracy. And then in rugby players, their immune function got better, and then they had improved reaction time. This is something that I'm interested in, and I've collaborated with some of my colleagues at UCLA, and we looked at some of our athletes there and had them use a wearable device and found that they don't sleep well, which isn't surprising. But we also tried to implement sleep extension, but found that it was really challenging. And that makes sense because they're trying to balance their athletic and academic demands, right? But what we found is that if they had more consistent sleep schedules, they had improved performance metrics, and we're publishing our manuscripts on this now, so more to come regarding that. But sleep consistency is the concept of having regular sleep and wake cycles. So that's on a day-to-day basis, and then during the week as well as weekends. And in the general population, we know that consistent patterns can have improved quality of sleep, but improved mood and cognitive function. And that irregular sleep can actually be a risk factor for cardiovascular disease. And then in college athletes specifically, or just college students, that sleep consistency can lead to better academic performance. So I think that we always talk about the number of hours of sleep that you're getting, but I think consistency of sleep is also going to be an emerging area that we talk about, especially with wearable devices. All right, I know it's been a whirlwind. I think I have a few minutes left, so we'll kind of jam through these, but I think it's good food for thought about some of the challenges or consequences of wearable devices. And, I think it's important to first do no harm and think about the scientific basis for all these devices that we're wearing. And is it perhaps contributing too much unnecessary information that might lead to stress or anxiety for our patients or for our athletes, right? And there's a lot of ethics about collecting data, and this is just an example of some bioethic journals that I don't dive into regularly, but I found that relates to wearables with regard to athletes specifically. And I think that we got to think about risking our players or patients' privacy and autonomy. A lot of these technologies are still unregulated, and there's a lot of concerns about data security as well. For those of you that use Strava is like a platform that you can upload a lot of your data to, but in 2018, a lot of our military personnel were uploading their workouts onto Strava, and then they created heat maps of workouts for other people to see, but they would actually outline where the bases were located, so that obviously prevents a security risk, right? For those of you that have Garmin devices, you might remember in 2020, there was a ransomware attack where all Garmin devices were pretty much useless, like my watch just told me at the time, but wouldn't really tell me anything else. This also impacted a lot of airlines that use Garmin as a navigator, and they held that ransom until they paid some sum of money to kind of get it back. And there's lots of questions about data ownership, right? So who owns the data? And I think a lot of our athletes are talking about that, and that's a big discussion. And as a result, there's lots of legality involved, and these are just some law journal articles that talk about some cases. And then are we creating a data-obsessed culture where stuff is all about the numbers and nothing but the numbers? And are we taking it a step too far, especially with social media where stuff is about how many views you can get, who can get more followers, etc. And are we too focused on the numbers, and are these really meaningful? And are we getting too caught up in the trees and not really looking at the forest? And then the validity and reliability of the data, I think, is really important. And so we need to better understand if these things are really monitoring and presenting the data in an accurate manner. This study I won't go through too much, but was a nice article that looked at a bunch of different wearable devices. It's super small there, but I included this because basically, as they test and look at the reliability and validity of each of these devices, they quickly get discontinued and then a new version comes out, right? So we're always kind of behind the 8 ball with the reliability and validity because we're always chasing that new device. And so I think it can be really challenging. And then there's implementation challenges. And I think this brings up the discussion that we've had throughout this conference about disparities, right? Who has access to this, who gets to interpret it? And then do you have the financial resources to really implement that? So I know that was a lot to go through, but we made it. So in summary, I think it's a huge exponentially growing area. There's many applications, both clinically as well as for performance enhancement. But I think we also need to be mindful about the ethical concerns and data security risks kind of surrounding that too. There's my references, and I'm happy to answer questions during the Q&A session, and go Roots.
Thank you very much, Dr. Nick.